Guys like me, everyday people can do it, right? And then you start looking at, not only is it going to regenerate tissue, but let's look about anti-aging. Let's look at what our cells are doing. You start becoming that chronic arthritic aging process in the joints, and then that becomes worse, where it gets to a point where now you're a candidate for like hip replacement, a knee replacement, because you chewed it down too fast. You have to adjust for aging. Just remember, it's about recovery. Everybody thinks it's a workout. It's really
the recovery.
It's the recovery is important.
Yeah.
You push yourself to one max rep.
Yeah.
Now you want to go ahead and recover from that, so then you have that stronger, better tissue.
This episode is brought to you by Agency Y. If your business needs cold calling, marketing, or any sort of extra leads, then get in touch right away with Agency Y. Go to agency, that's spelled AGENCYY.org. That's with 2 Y's. Type in Alchemist to get 10% off today. Again, that's Agency Y with an extra Y. Enter Alchemist to get 10% off today. And now, let's dive into the episode.
Today on the Alchemist Lounge, I'm joined by Dr. Tommy Rhee. Dr. Rhee is a sports chiropractor, a former Navy pilot, and a regenerative medicine innovator. Tommy has worked with elite athletes and spent years studying how the body works, how it performs, and how it recovers. His work now focuses on stem cells, and he focuses specifically on regenerative signaling and the future of non-invasive recovery. So today we're going to get into what stem cells really are, what's hype, what's real, and how this field could change the way we think about aging, injury, and performance. So Tommy, welcome to the Alchemist Lounge. All right, well, thanks for coming on the show, Dr. Rhee.
Hey, I appreciate this, man. This is a fun environment. This is the first time I've been in a live studio, so
Really?
make sure I don't fall down here.
Yeah, don't fall down, man. You can't fall down while you're sitting, so
No.
hopefully not. Well, I wanted to start this off because I'm intrigued about stem cells. And stem cells themselves are, at least the way I see them, is you think about someone really, really rich that flies to another country and gets some magic cells injected for an obscene amount of money and comes back almost, with some sort of like superhuman strength, or at least like some sort of longevity path that normal people can't afford. So can you tell me a little bit about what stem cells actually are and what signaling is?
Yeah. So stem cells, going into that analogy you're talking about as far as people flying and then getting therapy at a different country.
Yeah.
So there's some restrictions in America as far as stem cells. So let's start with stem cells. So stem cell is basically like a cell that has the ability to, they say, differentiate into a tissue you want to regenerate, if it's a tendon, muscle, musculoskeletal stuff. So the belief back then was these cells, they call mesenchymal stem cells. There's different kind of stem cells. There's adult stem cells, and they have different classification. Like there's totipotent, multipotent, unipotent. It depends how many times they can go into a different kind of cell. So these cells have the ability to turn on your existing tissue and say regenerate. Now, the old days, it used to be live cells, and these cells that have basically, back in biology, you have the cell membrane, a bunch of helpers, and then you have that thing in the middle called nucleus.
Yeah.
And that has a chromosome and DNA. Well, that's a cell. So when we hear about the word, I've got 20 million live cells, live stem cells, well, you're getting it. You're getting these cells that have that nucleus, and that nucleus has the chromosome and DNA. The difficulty with that is that you don't know what that chromosome is going to do. You don't know what it's going to code into. You don't know if it's going to be a follicle, liver cell, you don't know. So there's a risk it may be a tumor formation, right? Because you're going to have some odd kind of growth. Because if you're looking at a tendon from a tendonitis and you want to heal that, believe it or not, if you got a DNA code from that mesenchymal stem cell saying it's going to turn into this, what's it going to do? It's not going to know your existing code. It's a huge code. So then you start thinking that process is not really logical in the sense of how is that cell going to go ahead and replicate from RNA, DNA into a mitosis daughter cell into your own existing tissue. So it can't. So then you start thinking the next step, signaling. Signaling is the biggest thing that our body does. We have hormones that signals our organs of what to do. And same thing, we have signals that do stuff for our tissues. If it's to regenerate, if it's about insulin, it's signals. Everything our body does is signals. The difficulty is that when we age, we lose the signal. So then, of course, as we age, we start getting that aging process of our generation of skin doesn't really get healthy because we don't have that good ability to recycle ourselves. Right. So the signal decreases. So that's what stem cell does. Stem cell gives you that signal. But as we age, those signals get declined.
I see. So where does the signal emanate from?
The mesenchymal stem cells. We have that. So interesting enough, we have signals, but we just have to have the ability to say, alert, do something. There's going to be a possible time in our life that you're going to have a broken bone. Well, guess what? You have to get this whole cascade of growing new bone tissue. You have to send a signal out. The signal goes out and it tells the body to lay down more bone tissue. And then that information needs to have that, signal to do the osteoblast, they call it, to grow more bone formation. So now with stem cell, these little signals, they call it EV, extracellular vesicles, information. The neat thing about that, it's what they call cell-free. There's no nucleus. So now you have this membrane, and then you have the information. The information can be in like protein, cytokine, enzymes, but it's just information in this little capsulated area, but there's no nucleus. There's no possible tumor formation. The neat thing about that, it's a smaller molecule. Now the thing is about that is that now you don't have to take a big, like a needle and then inject it. You can do a different kind of application with this. So that's why you're hearing a lot of big things like peptides, exosomes.
Right.
These things, those are cell-free. There's no nucleus. It's safer. And that's where we're moving towards.
So peptides are all over these days. I mean, there's all sorts of different peptides.
Yeah.
GLP-1, you have peptides for all sorts of athletes, even amateur athletes, just people that are just working out or just using peptides. So can you just break down for someone like me who isn't a scientist at all, has absolutely no experience with this, but I'm aging and I'm also, somewhat athletic. Like, how can you tell me, like, breaking down a peptide and why a peptide might be good for a regular person aging versus, let's say, an exosome or a cytokine, or kind of break down the differences of all this?
So let's talk about peptides. Peptides can do two things. It can turn on and turn off. So think about GLP-1, right? GLP-1, it inhibits the actual, like the satisfaction of, or the hunger, right? You want to eat something, so it suppresses appetite, right?
Right.
So what it's doing is turning off things. So with that type of enzyme or peptide, it shuts that off. So there's other ones that turn things on. For instance, there's that one that we all heard about, what's that, BPC
157.
157, right?
Yeah.
So that one, it turns on what they call a I apologize here, it's called, it's new blood formation. It'll click at me here a second. But okay. It has the ability to make new blood vessels. So because of that, that's why tissues heal faster, because you're creating new blood vessels. But there's also a problem with that too, because let's say you have something you don't want blood flow, right? Let's say you have maybe a possible, like a benign type of tissue or tumor,
right.
And now you give more blood flow to the area where you're going to grow it. Maybe it's going to turn into a malignancy. So you got to be careful with that. So that's peptides, and it's just like a amino chain. Then you look at enzymes, right? Enzyme, again, signaling. Right? It does two things, right? It does a lot of things, and it turns on, turn off. But we all have receptors in our cells that want this information. Some accepts peptides, enzyme. It all depends on the target tissue. So if your target tissue, say your pancreas, or you want to go ahead and release insulin, well, there's going to be a signal that tells us the pancreas to secrete that. When it secretes that insulin, because there's glucose in the bloodstream, it grabs it and it's got to match up. It's about the receptor, right? It's got to be the right position and the right kind of shape to connect that, grab it, and then it does its job to take the glucose, or the heavy sugar, out of your bloodstream, so you get the viscosity back to normal. So it's all about like signaling and different patterns. So it's in a sense like, if you look at proteins and microRNAs, it's just information. It's all just information, and really what's important is the target tissue, what it wants to do, because it has its particular job to do.
Right. And so we were talking earlier, so signaling starts to decrease as you get older. Does that happen throughout your entire body? Does it happen in certain parts of your body first? The signaling, does it decrease at a certain rate? Or explain that a little bit. Like, as you're aging, how does signaling decrease, and how does it impact all these different areas of functionality?
Let's go down to the simplest form of just going back to the nucleus and the chromosome.
Yeah.
So let's just go with that. So we have an ability to replicate our tissue, right? We always want to, we have the tissue that kind of gets old, so we have to replace it with new one. So we call it like that 1-to-1 ratio, right? And then it keeps us like status quo as far as our tissue and our health. As we age, again, we lose that signal, but what signal are we losing? So you think about this thing at the end of the chromosome called telomeres. Mm-hmm. So we all heard of telomeres. Now, telomeres are the protective caps at the end of the chromosome. Mm. So as we start doing this replication, every time we start making this thing called daughter cells through mitosis, we kind of chew this telomeres down and start shrinking. And because of these codes, these 4 letters, right, these 4 little codons are on this chromosome, it makes a tissue, it's coded for something. Well, it's got its pattern. Here's the thing, if you don't have that protective mechanism and it starts duplicating and it starts mismatching letters, well, now you're in the tumor formation. So that's our natural way of protecting our body to not make tumors. But the problem is that once those telomeres shrink, the cells go into a thing called senescence, like a zombie state. It stops replicating. So when it stops replicating, now we're just basically sitting dormant and the tissue can't regenerate. So there's one cell. Here comes another cell. So now as we age, these cells start multiplying because we can't get out of that senescent state. Now, Elizabeth Blackburn, she discovered there's an enzyme that increases telomeres called telomerase. That's the enzyme that increases. We have it in our body, but again, as we age, it decreases. So we need to introduce it with something. So our body, depending on your genetic factors, it all depends on what ages faster. Some people age faster in the hair follicles, some age differently in different parts of the body. It's always different on everybody. But if you can really understand about that cellular mechanism, about telomeres and telomerase, and understanding just a simple cell, start there. That's where you want to start. So when you can understand that, now telomerase, the enzyme, how do we increase that? How does our telomerase deplete in our body? That's the big question. It depletes because we age, we have free radicals, we do oxidation. We have to figure out a way to reduce this process of decreasing telomerase in our body. Yeah. If we get to that point, well, we need to introduce it with some signals. Well, believe it or not, mesenchymal stem cells increases that because they have their own enzymes from their donor side that increases in our body's telomerase. So that's what you want to do. Look at the molecular side of things and start with that. And then you can go expand into the organ and the different type of bodies.
Yeah. Well, we're going to have to unpack all this because you gave me a lot of information that I want to start putting something around and actually start taking action around. But first, what I find really interesting is that you started as a Navy pilot. So how does a Navy pilot, end up as a chiropractor and then end up in sort of the longevity space, the healing space? That where did learning about your body and all of this come from in terms of when you were a pilot?
Yeah. Well, I wasn't a pilot. I was a backseat guy. So I was not the actual guy that held the stick. I was the guy that does all the sensor operation and all the ESM X-ray. But I was still in the aircraft. So let's see. It started off. I started off like anybody else in high school and stuff like that, and then I was like a typical kid that was athletic and just got into. Oh, all right. This is the truth. Okay, here we go.
Tell me the truth.
All right, here we go. All right, so I was a typical ABC after school special. Asian migrant family in the countries of Florida, right, growing up. So I had a tough upbringing. It was one of those things where I didn't know who I was. I had no reference point as far as my culture and how do I relate to what my family inside the house and then going outside. So because of that, the typical, conflict, clashes, angry at life. And so when I was a kid, I was pretty much one of those typical kids that was rebellious and thought everybody hates me and nobody likes me. And so that became one of those things that kind of perpetuate me into sports and being kind of violent in that world. So with that, I knew that I had some issues, and I came across the law, and they said, hey, you got to figure out what you're going to do. You got this path or that path, which is the Navy. So
Yeah.
I took the Navy course, and then thank God it straightened me out. So
Yeah.
luckily I was smart enough to take any, those tests and have any job. So then I said, well, I want to have a fun job and understand that just basically just enjoy my time in there. So we'll take this. This is a very difficult course. It's they call it a ASW operator. So it's like it's a hunt submarines in the back of a plane. So there's like 3 platforms: helicopter, jets, or patrol plane. So I said, I want jets. I want the fun stuff. I think it came out during Top Gun. So that kind of
Yeah.
like I said, hey, wait a minute, I can blend in these two together.
Yeah, girls will like it. Yeah, I like
Get
it.
the leather jacket, get the whole thing going.
Yeah.
So then that's how I got in the Navy and flying in the Navy, and just somehow it was just meant to be. I was just like, it was simple for me. It was like, this is great. The great thing about the military, kind of like introduced me to different cultures, and now we're all one. Where there's no dominant race, there's nobody. Everybody's just, we're all like, back then we're all like just scum, right?
Yeah.
Boot camp, everybody's all pretty much on the same level. But then when you come up and then you learn about how to set goals, and they teach you about these life's lessons, how to accomplish, how to finish things off, and how to never quit. And then it just became like inherently built in, like a conditioning, right? It just built into me. So from there, I started thinking about what I wanted to do, and sports doctor. So then when I got out, got in that world, and luckily my first job was at UCLA.
Yeah.
And then with that, it was easy from that point on, because now I see these high caliber collegiate athletes. And then these guys, I get all the sports: football, tennis, golf, water polo. I get to see every type of sport in their high caliber and their typical injuries that they go into. So with that, these kids graduate and they go to the pros, the Olympics, and I'm going along with them. So during this time, now you're starting to see advanced therapy, advanced equipment, all these neat things that are out there that people haven't heard of, but they're being utilized by these pro athletes. And of course, I came across regenerative medicine, and then like stem cell therapy. But back then, back in 2007, it wasn't really like stem cell. It was more of a thing called prolotherapy. Some of
What's
you
it
older
called?
prolotherapy.
Prototherapy.
No, prolo.
Prolotherapy.
Yeah. So it's basically shooting sugar water into a damaged tissue, and your body thinks it's the antigen, and it lays down more scar tissue. So that was
Interesting.
But the neat thing about that is that there were doctors in Mexico, just like how we have stem cells here, but we also have it down in Central America.
Right.
Well, they have the same type of mindset. Goes, hey, come to Mexico and we'll give you the better stuff. So there's a guy down in Mexico shooting stuff like formaldehyde and all kinds of. Hey, look, these athletes will do anything. So I'm looking into it. Goes, are you serious? So then I do my research and I figure out, the guy lost his license in U.S., Canada, Europe, and
He's now in Mexico.
he's in Mexico doing how it's Wild West down there.
Yeah.
So from there, I started, it moved into PRP, which is platelet-rich plasma. And then that's where you take your own blood out of your body and you do a centrifuge and you inject your growth factors back into your damaged tissue. And so that was the trend. That was probably like 2010, 11. Okay, so the science behind it works. But the problem is that it's the same type of signals that your body has. It's still there. So the same level. What you want is the more vibrant, the sharper signal, right? You want the younger tissue, right? So then stem cell came around. So stem cell is a neat kind of like theory that we were back in the 50s. They found this mesenchymal stem cells, and they had the ability to differentiate, but they couldn't really talk about the mechanism of what it does. They just said it just knows what to do, and that's why. All right, well, the results are there. It's regenerating tissue.
Yeah.
So then, as you understand about where we have our mesenchymal stem cells stored at, and it's basically in our bone marrow or in our fat tissue, then you start understanding, well, okay, great, it does its job, it's healing, but it's still the same signaling. It's the same type of level signal. You want the stronger one. Then they come across with the umbilical cord, they call it Wharton's jelly. That has a higher signaling power because it's younger, vibrant. It grows tissue fast.
This is where they say it comes from babies.
Comes from babies, but it's the umbilical cord, right? So there we go. So now we're on that process. So now, fantastic, it's doing a great job, right? But here's a question that you have to ask is, when you hear about the word live stem cells, is it really live? So then because I'm in the world, I'm seeing this firsthand, and I'm thinking like, okay, I see the procedures, I see what they do, but there's a disconnect somewhere here. So when you do the injection, this tissue is obtained through a lab. The lab ships it cryo in a cryopreserved package, and it comes in a vial like 1 or 2 cc's.
Where do they get it?
They get it from the umbilical cord, Morton's jelly. So during C-section delivery, they'll ask the mother, would you like to donate some tissue? And then, for your donation, we'll give you a discount to bank your blood, for your child. So then when you obtain that, so anyways, so the lab, so the lab ships it to you. And the lab ships it to you, it's in the cryopreserve, it's pretty cold, right? Negative 66 degrees. So, but then the part of the procedure they tell you is to defrost it with your hand. So you take this little vial and you put it in your palm of your hand and you just close your hand and then it defrosts. And it turns it back to like a gelatinous or a liquid material.
Right.
Well, if you understand about the process of taking a cryopreserve into a live tissue, there's a step process. It's a long duration of time consumption to get that negative 66 degrees to like room temperature is 70 degrees. It's like every 10 degrees, it takes 10 minutes. So now, if they're teaching you how to defrost it with the palm of your hand, it's called shock thaw. You kill the cell, it's dead, but it still works. So then all of a sudden I understood, goes, okay, now I know it's not about the live cells. So when people talk about live cells, that's not the importance. It's what it secretes. Then you go into the other things that are talked about, or like the exosomes, information, cytokines, enzyme. That's what really is important. It's the receiving information that gives into that tissue that needs to be repaired.
I see.
So that's where you're seeing the trend. You're seeing the trend moving towards away from live cells into that world of signaling of these type of cell-free. So going back to your Central America and Mexico guys. If you look at what they do a lot of things, right? First of all, they get them out of this stressful environment of work and they stay down there for a week. And they put them in a nice resort. And they do other therapies besides the injections.
Right.
They do hyperbaric chamber, red light therapy, massage.
It's included.
It's all that. Now, is that possibly a variable in their healing? Absolutely, right? Maybe these stem cells are not what's really healing them. It's just they just need to shut their body down for a week, get away from stress. And one of the factors you always...
That's interesting, yeah.
Hey, one of the factors you'll hear also is that when these people go down there and do this live stem cells, they always talk about being sick. You'll hear that goes, I was sick for a couple of days, but I feel better. Because you injected live stem cells, and then your body looks at it as an antigen, like a virus. It attacks it. So that's why you have to be careful when you hear about the word live cells. And then the worst thing about it is you don't know what kind of tissue you're getting. Are you really getting mesenchymal stem cells? Are you getting like bovine or pig tissue?
How do they regulate that, or is there any way to be able to tell whether or not there's a legitimate source, or whether you're getting, like you said, like cow stem cells, or
in Mexico, that's a whole, go ahead, good luck on that one, right? Because it's basically down there, it's all about money, and the tough thing is that since stem cell is getting very popular, how many people can give babies and donate tissue, right? And then on top of that, you have to vet the patient or the mother, make sure that they don't have any like STDs, they don't have no pathology. So there's a screening process, and not a lot of people can pass these screening process. So we're starting to limit ourselves with this type of tissue. So basically, these labs are running out. So they will do tissue that are not actual like mesenchymal stem cells. They may get it from somewhere else that's close to it. They say, hey, it's close. At the end stage of the clinic, they don't know what they're getting. There's no testing. They're just trusting the lab, and the lab is not really regulated either. So the FDA has a wide, like a door open right now with this therapy.
So we're thinking about athletes, right? That are potentially traveling to heal some sort of injury. So what do you see as being the difference between just sort of treating pain or healing and actually like restoring function? Because an athlete, it's much different than someone like me, right? I had a full tear in my pectoral muscle, and they just said, let it striate back together, it'll come back. You're not a professional athlete. But professional athletes need to they earn their living from being able to just have that little 1% more than the other athlete. The competition is there. So what do you know? How do you advise professional athletes around that in terms of you need to restore your function and increase your level of performance versus basically just treating pain, basically just general healing.
Yeah. When you look at professional athletes, it's not so much about the healing, it's about the speed of healing. They want to get back quick.
Fast, yeah.
So, for instance, your pec tear versus a defensive lineman pec tear,
Big difference.
it's a difference in the sense they want to get back on the field. They want to get going as quick as possible. Whereas, you've got time. You don't need to. Your money is not, surrounded around that injury where they are. And the worst thing about these pro athletes is that when you have an injury and it's recorded, the tough thing is that when they want to renegotiate the contract, it comes up. So stem cells is very important. They want to say, hey, I'm back, I'm 100%, and I need to get back quick, so then that won't be a negotiating tool on the actual contract. So it's about the speed for them. So they'll heal if you give them time. But to speed it up, regenerative medicine speeds things up fast. So that's why athletes are very prone to like this world of like cutting edge stuff. They want everything fast. They want everything neat, and that's one of the things, stem cell therapy. But the tough thing with stem cell therapy for athletes, they don't really do it during the season. The tough thing with stem cell therapy is that when you do the injection, you're basically creating a secondary injury site. You're making more trauma. So your body basically has to fight two things, the primary injury and then the needle point. So then that's why they say after you do a stem cell therapy, don't do nothing for the next week or two. They want you to shut it down, downtime. Well, athletes don't want to hear that. They rather mask it with pain meds and then continue play. So that's the big factor. So that's why my athletes, they always talked about there's got to be a better way of delivering these stem cells, these signalers down to my tissue to regenerate than this needle thing. So that's why that whole world of what I got involved with, the topical, came up.
Ah, that's a very good intro. That's a very good bridge into topical, because I didn't know there was anything aside from just getting an injection in there. Explain the whole topical side of this.
Yeah, so topical. So going back to what we're talking about, these cell-free, those smaller molecules. When the molecule is smaller, now we have the potential of getting it through the skin. We just need a vehicle to pull it through the skin and get those signals, right, into that damaged tissue because it's smaller, right? So that's what I was looking into. So because of those factors of these athletes had the downtime and all that, so I said, all right, let me find something out there. So the FDA utilizes, there's already like mechanisms right now to use any type of topical to get it through the skin. And one of those things is called DMSO. You heard of that long time ago. And it's still used in drug delivery systems. So I was thinking, hey, let's use this and then take those small molecules. You will break up that skin, that stratum corneum, that tough skin, and then open it up and pull in those biomolecules to go signal your existing tissue. So now we're thinking about how do we get this tissue to this human tissue, the signaling, right? The EVs they call it, right? Well, how do we keep it longer? Then we started thinking about, all right, we need to do some type of like protecting mechanism. Well, that's why we think about doing some type of lipid nanoparticles and surround this type of signals to give it longer shelf life. Well, now we have that. Now we have a protecting mechanism to have a longer shelf life. Now we have a delivery mechanism. Now we have the cream. Now we have to apply. So thank God I had a bunch of athletes and they're willing to try anything out. Right? I said, let's try this out. So they're getting traumatized in football. Goes, I'll try it out. I don't care. I need to keep going. And great success. Great success. I was like, wow, it was interesting. Had a quarterback that had Achilles tendonitis. You know the great thing when you see some guys with a little bulbous type of tendon back there and it's about to rupture. Yeah, so he was worried. You hear about all these tendon pops in the field. Because the field is it's harder, people are faster. Yeah. So he was worried about that. So he used my cream, Regen, and then he helped me tune it up because it's too hot, too cold, turn it down a little bit. So he helped me actually like formulate it perfectly to where it's at now. So then with that, he was able to last the whole season. And then the most important thing, contract-wise, did fine with the contract. It was not even a discussion in there.
Really, on the topical Regen. So I sort of understand exactly how it's kind of pulled in, but explain to me what's exactly inside of the topical that and how can you possibly have be able to impact as well as an actual needle into the like placing the stellum, like how does it, like explain that?
Hey, good question. So let me tell you, where it really started is when I had
Yeah.
When I'm in the world of the injectable stem cells, you
Yeah.
have to take classes, right? So I'm taking classes, I'm seeing it, and I see the old way of injecting the damaged tissue, right? So you take this ultrasound, and then it's kind of like they call it, it's a diagnostic ultrasound device that you can basically just, it's a handheld device, it plugs into your cell phone or a iPad, and it's pretty cool. You can see things. But there's also a point where you can see the needle go into the tissue, and then you can look at the target tissue, and you can guide it.
While it's happening?
Yeah, it's real time.
So you're looking at your iPad, and the needle's going, and you can actually see it going into the.
Yep, because you want to target the tissue, right?
Right,
So
right,
let's say
right.
you're going after your pec, right? So
Yeah.
I want to go at where the actual tissue is torn, and I want to aim it. Some people just go blind, right? Doctors would just go blind because I kind of have the idea, let me just shoot in there. Well, if you're really specific, you want to go ahead and make sure you get the ultrasound so you know exactly where the syringe is going.
Makes sense.
So then at first, the first couple classes I went to, they would say go penetrate through the damaged tissue and inject the stem cells, right? And then you know you have the best delivery and the most accurate spot.
Right.
Well, then we found out that you're compromising tissue because now you're damaging tissue and it's not doing its job because you just basically increase the injury site. So now they started talking about be approximating. So let's say you're at the same area of the pec, they say go near it. So then you start seeing the distance. Like, wow, that's a pretty long distance. Yeah, don't worry about it because the tissue has this thing called honing. It hones in those signals to get to that area and then signals your existing tissue to do its repair. So honing, I get it. So then we have a kind of like a mechanism that tells the tissue that's distance from the injection site to go into that area. Then you start looking at the distance where it's going and it's like sometimes 2-3 centimeters away. Like, wow. Then you kind of invert that, goes, well, your skin is about that deep. Why don't I try this? So that's how I started going into the world. Because you don't need to actually be right in the damaged tissue. You can just be away from it and it hones down. So then
Interesting.
so if you look at everybody out there that's doing injections, you'll see they won't actually go into the tissue. They'll go near the tissue. When they go near the tissue, it has to migrate down. It migrates down because it's honing into that damaged tissue, and voila, that's how it gets to that tissue. So then I'm thinking like, well, why can't I just put it on a topical sense and do the same thing? And that's how it all went that path.
Wow.
Yeah.
So when you were working with this quarterback and you were giving him, like, explain how the pain started to alleviate, how the healing happened. Like, did you actually go in and see the results between when it first started and?
No, he's very secretive because, here's the funny thing with like NFL guys, man. They don't want to be around guys like me because it gives red flags to the team. Goes, hey, what's going on with him? So it's like one of those secret things. So it's like, we had to talk on cell phones. I mailed him stuff, and then he said, turn it down, turn it up, and it was that kind of conversation. And he would tell me, doing great, I'm doing better, I'm at 100%, and it's lasting. Prior to him going into camp, that's where the injury occurred in the summertime off season.
Oh, I see.
So because he's going into camp, he's like, oh my gosh, I'm going into camp with these 2 Achilles tendons that are irritating me and may rupture. So with that, we started a process, and it's all right. This is what we want to do. Just stay with this program, and then we'll talk. As we talk through the cell phone or text message, he would say, "I need it this way. It's too hot, too cold, whatever." Right?
Yeah.
And then we worked on that sensation, but in the meantime, he's still applying it twice a day, going through it. The neat thing about that, it reduced the inflammation that was there. Yeah. He had more of like that sensation of having no pain longer, and now it's starting to get to a point where it's healing properly. It takes time because
while he's
going, that's the most important. There's no downtime. So the neat thing about that is that athletes like this because pain meds will basically mask the pain, but you're going to increase the injury site because you don't feel nothing. All right, I'll just tear this muscle up, and that's why you hear about these after-season surgeries because they have to fix whatever they did during the season with the pain meds. So because of that, he helped me kind of like work on the side of the sensation component of it and how to like thicken and thin and make sure it's just good type of like saturation and viscosity of it. So with that, he was excited about it. He goes, this is great. So from that point on, other athletes liked it and they talked about it. And then I'm thinking like, well, if athletes at their high caliber of like performance, weekend warriors, guys like me, everyday people can do it, right? And then you start looking at not only is it going to regenerate tissue, but let's look about anti-aging. Let's look at what our cells are doing. Now we're going down that path. Now believe it or not, when you do a topical, it goes locally, but it also goes systemically because it gets absorbed in your bloodstream. It goes through your body. Now your other parts of your body receiving it. Now you're talking about those telomeres and all these cells. You have to increase it. There are some senescent cells, zombie cells, sleepy cells. Wake them up. And that's why you just want to continue on. You need to keep that signal going. The signal is always going to be low until you introduce it with a brighter signal. That's why our body needs a constant signal. And we need to keep it going so it's bright, strong, so it does its recycle 1-to-1 ratio.
Yeah, well, you say something really interesting in terms of, just a regular weekend warrior. I mean, this quarterback injured himself when he was on the off season. So he was doing something that necessarily, maybe he was practicing, maybe it was something had nothing to do with sports, right? Which we all get into situations with. So, well, first of all, what do you see just normal people doing that totally wrecks their body? Like what's something that people that come to you and you see more and more often?
Alex, I'll be honest with you, man. It's everything. Think about everything. You think about repetitive movement over and over. Remind yourself that when you start using a tissue, your tissue gets a little bit broken down. And then we have to go through that recovery stage and build it better, right? Stronger, better, right? That's why we work out. We break down muscle tissue, make it bigger and better and stronger. Well, as we age, our signal gets declined. So we can break down tissue easy, but it takes us longer to recover. Not, like when we were kids, we can recover in like a matter of days, right? Now, weeks.
Oh, yeah.
So when you do a workout, you can't do that every other day workout. It's got to be every third, fourth day of that same muscle group. Because you have to have that signal to regenerate. And when we age, our signal declines, so we don't have that ability to quickly recover like we used to.
Yeah.
So that's the big thing, is that recovery component of it. When you understand about that, now you have to think about, well, what are we doing? Mouse usage, use the mouse, you get the elbow pain. You're doing stair climbing, your knees, your tendons, your knees, they start aching. It's that repetitive movement. And then the worst thing about it is that you still have to do those movements, so you don't give yourself some, that time of rest. Especially with ankles and knees, you always want to walk. You always want to be that active person. So when you start thinking about those repetitive movements and then you start breaking down tissue and you don't have the ability to recover from that thing, well, guess what? You start becoming that chronic arthritic aging process in the joints. And then that becomes worse, where it gets to a point where now you're a candidate for like hip replacement, a knee replacement, because you chewed it down too fast. So that's what I'm concerned about everyday people. It's that repetitive movement, the repetitive cycle that you don't have the ability to regenerate or get that rest time to kind of get those cells back to normal.
And is there a particular age group when that really starts to become more and more of an issue?
Oh man, it starts in your 30s, starts in your 40s. You don't feel it till your 50s, 60s, because it takes time to to break it down. You generate just like the old I'm at 100% and I break down 10%. Well, if I give it only a 5% recovery, well, my starting point is not at 100%, it's at 95%. And you keep that cycle going. You keep pushing yourself. Pretty soon you're starting at 50% of your cartilage. And that's where the damage occurs. That's where you're thinking about, I'm getting to be bone on bone. Now here comes the more difficult issues I have to deal with. So that's the big thing. You have to get the signal to regenerate quick. Think of yourself like an athlete. You want to be like an athlete, recover quick, fast as you can, so you can get back into the activity that you're repetitively doing.
Yeah. Well, someone like me, I mean, I still work out 3 to 5 times a week, right? And sometimes I'll do a movement for a particular muscle group twice a week, because that's what I did. I literally have the same workout probably over the last 15 years that I continue to do, just because, you just get used to doing the same thing. But you recommend, first of all, like based on what you're saying, that when you have these repetitive movements and you're breaking things down, it sounds like you have to adjust for aging.
You have to adjust for aging. Just remember, it's about recovery. Everybody thinks it's the workout. It's really
the recovery.
It's the recovery is important.
Yeah.
You push yourself to one max rep.
Yeah.
Now you want to go ahead and recover from that, so then you have that stronger, better tissue. It may take you a week to get back to that 100%.
Yeah.
So it all depends. You can get away with 2 times, 3 times a week, but you're not going to go at 100%. You're just maintaining. You're just cruising. You're plateauing. You're not trying to do that performance like, I'm going to go do a 275 bench press right now, and then 2 days later I'm going to do it again.
I am like that.
Are you really?
Unfortunately, but I'm not doing it 2 days later.
Okay, well, that's good. So if you do
Yeah.
it 2 days later, then
Yeah.
you'll definitely see some issues that you're going to talk about here on the show by saying, I just tore my rotator cuff muscle. So,
Yeah.
yeah. The thing is that it's all about the recovery. It's all about understanding how to get back to zero, 100%.
Right. So you need to take more time between workouts, basically.
Or regenerative medicine.
Well, I'm fascinated with this cream. I am fascinated. There's so much I want to ask about this because this sounds like it's solving quite a few of the issues that you have with stem cells. I mean, first of all, topical application is a lot easier, just practically, right? And you don't have the damage and you don't have the downtime. Are you going to Mexico to to get the cream?
No. So we have a lab
Yeah.
in the Midwest that does our vetting for our donor site, and
Yeah.
then from there we obtained it, and then they do all the stuff that I need done, and then we
Ah.
get it to ourselves.
Wow.
So yeah, when you think about Central America, Mexico, I understand people are desperate. You
Yeah.
know, the thing with being desperate, you have to be knowledgeable at the same time. You know, it's a lot of trust factor when you get down there. I mean, you can, what do they say, dress up a pig, right? All you want to, it's still gonna be a pig. You got to be careful. You've got to understand what you're dealing with when you get down there, and that's where my concern is. And then even in America, you don't know what's going on as far as these labs. Some labs, if they're not FDA certified, or interesting enough, FDA is shutting down some of these labs that are doing unethical things.
Yeah.
So you're going to start hearing more about this. The FDA is really coming down right now.
I just saw that. As a matter of fact, there are so many for lab use only types of medicines that are out there that you can just buy with the click of a mouse.
Yeah.
And there isn't, as far as I know there actually is I'm assuming a regulatory body there, but it's not something that your average ordinary person who's out there looking to increase performance or has some sort of injury or just someone who's getting older and they want to live longer. There isn't something necessarily you can point at, or is there, that you can look at something and say, oh, this is this is scored at 100, right, or something like that.
Well, if you go to a clinic and you do the stem cell therapy or injections, there should be a traceability, like a form that you can see as far as the donors, their metrics, their serology, any type of blood work and all that pathology, and then clear it off, and then and then provide it to you for that particular tissue you get. Well, here's the thing. You're on trust again. You don't really know. Could it be just basically Xerox copy and go, here, stick it on this guy. Don't worry about it. They don't know any difference here. Just give them this piece of paper. So that's where the concern, what I saw, I've been in this world since 2017. I've seen things go bad quick. So I see how the FDA is looking at this tissue, and my concern is that these labs, you don't know what you're getting. My lab is good, but there's still a point where you have to start questioning what else is going out there, especially how popular this whole therapy is.
Yeah.
I mean, you don't have to have that many donors. I mean, you're looking for that perfect donor. I mean, it's going to be tough to run, get that kind of that supply.
Yeah.
So then my concern was that the efficacy and really the quality of this tissue. So then advancing to the future here, it's all about signals. So I started looking at this, right? We're looking at signals in the sense of telling your tissue to do its job. Well, each of our target tissue have these adult stem cells that we're trying to generate to open up to do its job, right? So muscle have they call it satellite cells, tendons got tenocytes. We all have these particular cells that start the engagement of regenerating. Well, these cells also have receptors and they want that signal. The signal can be equivalent to plants now. So there's big research on that. A lot of paper on that. The neat thing about that is that now, if you understand about the signals that are coming from the human tissue that's comparable to the plant-based, now eliminate this side. Now go with plants. Now understand about the transdermal component of it, get it through the skin. Understand about the target tissue. Now you've got yourself a safer, more ethical, and you know exactly where it's coming from, and the cost a lot better. That's what I'm excited about. That's where I see me moving towards right now. So I've got a lot of testing right now. I'm in the process. We're really close. A couple patents here and there.
Wow.
That's where the future, I feel, is that signaling your existing tissue with a plant-based.
Ooh, I like that. So when you're looking at the plant signals, and you're seeing sort of they're almost analogous to human signals, right? And how long have you been doing that sort of research? And
Well, here's a great thing. The research is out there already.
yeah,
I'm just taking pieces of it and say, all right, let's take what is out there and try to figure out how we target. Then we just start going after one tissue at a time. Okay, let's see what that does. Let's see if it regenerates. But the tough thing is that it's being applied right now to the cosmetic world. A lot of these ingredients are out there.
Yeah.
But the tough thing with
Yeah.
cosmetic is that you're just looking at your target tissue is the skin. I need to penetrate through the skin. So that's my first step. I've got to I had to develop a transdermal agent because DMSO is regulated by the FDA, so it's classified as a drug. I need to get a plant base. I've got that. We're testing it out. It's called a in vitro permeability test. We're going through that process right now. Looks good right now. So once we get past that point, now we have something that actually have a mechanism to pull through the skin naturally. And then it's about those signals from the plants. That is out there. There's so much information about that. All I gotta do is look at each target tissue and look at what plant it is and then start playing around with it. That's the secret, just getting everything together. That's what we're talking about all this information out there. We gotta collect it and consolidate it and put it together. And that's what this whole process that I'm going through, from the start of prolotherapy to stem cell injections to topical human tissue, now plant-based.
wow, things are evolving so quickly. Let's talk a little bit about longevity. That's big. Everybody wants to live longer.
Everybody wants to do it.
So what are some practices that you could, like a practical person who's starting to get up there or just wants to make sure that they can I don't want to say defy the aging process, but let's say slow down the aging process. What would you recommend for people to do?
Exercise.
Exercise.
You've
yeah.
got to exercise. Here's a tough thing. For us, we're athletic. We started at a young age.
Yeah.
It's easy for us. For
Right.
someone in the 50s that's never done it and want to enter this world, it's tough. You're
Yeah.
talking about they don't know what the feeling of soreness. They don't know the feeling of
Right.
the aches. You're going to come across these things. And it's,
course.
when we're introduced in a young age, we just know it's a normal process. So that's a tough thing. You think about the chronic problems that we all as humans have, right? We have that cardiovascular issue, we got diabetes,
Right.
and it's circulation. That's the first thing. You have to have a good communication, a good pathway. So that means your vessels. It has to flow correctly. So when you age, you get that thing called like arteriosclerosis, when you start thinking of the hardening of the actual arteries.
Yeah.
Well, you have to have exercise to exercise the vessels. When you exercise the vessels, vasodilates, vasoconstrict, you're having that mobility in your vessels because you want it to move up and down or dilate and contract. That's what's important. You have to have the ability because when you stand up, your blood vessels have to contract real fast and push the blood to your brain so you don't pass out. But the opposite has to happen where you have to have relaxation. The vessels have to open up to receive more kind of fluidity so your pressure goes down. Sympathetic, parasympathetic. So that's the big ingredient right there. If everybody wants to start off with that anti-aging in their own world, exercise. But the most important thing about exercise is that you have to move. Well, here comes a cascade of pushing yourself, exercising, and if you don't have that type of tissue that can't regenerate, well, guess what? You're not going to work out. When you don't work out, you don't exercise, and then here comes the hardening and the problems. So it's a what? Chicken or the egg? What do you want to deal with, the tissue or the exercise? So
Yeah.
it has to go together.
Yeah, well, we talked earlier before we even started about discipline and how important that is, and how really anything is possible with having that amount of discipline to be able to make sure that, hey, that exercise, regardless, you just do it and you gamify it. And it's easy to gamify exercise in a lot of ways because literally you can just play games.
Yeah.
Right?
You got to always trick the mind. You always got to say, hey, we're not going to go work out. We're going to do this. Let's go play with that. Let's see if we can do 100 reps with 30% of the possible weight you could do with like curls or something like that. You got to switch it around.
You have to switch it around. You can't keep doing the same things.
No.
What about diet?
Important. I mean,
Yeah.
that's the building blocks of what you want to actually use to rebuild your tissue.
Yeah.
Protein's great. Carb, you need carbs. Believe it or not, you need carbs. Complex carb, better, but you need carbs because
Yeah.
that's glucose, that's sugar, that's energy. You need
Right.
that. The brain needs it.
Right.
And then you need all the nutrition and understand healthier the better. Look at your ingredients. Processed food, try to eliminate that. And then every time you do that route, look at the ingredients. If it's longer than a typical like a Bible verse, then you gotta maybe eliminate that food.
What should you avoid?
I try to avoid anything with trans
Yeah.
fatty acids. You know, anything that has the complication of like clogging up your arteries. You know, remember the old days of margarine? Remember how you can sit margarine out room temperature and never melts?
Yeah.
Well, that's what's going to happen in your arteries. You want something that can like liquefy quick. You just want to, because once it gets in your bloodstream, you want to have that ability to like flush out, not clog up and
Right.
give you that world of stroke or heart attack.
Right. So its ability to sort of dilute and its
Yeah.
ability to wow.
Yeah,
So avoid trans fatty acids.
trans fatty acids. It should be gone. I mean, you hear the stories that they're trying to eliminate that from our foods. You know.
Yeah.
Like I feel that if you understand your body and you do have that bad diet,
Yeah.
you better go pay for it with an exercise. Go work out hard. Get those blood vessels to contract, relax, and push yourself.
Yeah.
Pay the price. If you want to have a good pizza, you want to enjoy yourself, well, next day go kill yourself in a good workout. And then you can have that satisfaction, right? I rewarded my discipline, right, of working out from that bad food.
Yeah. What about people that, they feel like their bodies are breaking down at a certain age, right? Like maybe they have some kind of routine and they just feel like their bodies just aren't where they used to be. They're breaking down, they're getting tired, they don't have the same, energy that they used to. Because, we hear all the time, right? Like exercise, eat right. That's been going on as long as I can remember, right? And you still have like the breakdown of the body. So what do you tell someone who might be listening to this who they're really feeling their body breaking down? What's the first thing that you think they need to do?
Well, you have to understand, going back to breaking down, that's like athletes call it overtraining. You're
Right.
pushing yourself past the point of recovery. So you got to think about recovery. So let's say you do a twice a week workout with chest. You're working out chest, and then you're starting to lose your performance. You're losing
Yeah.
performance either by reps or weight or something, right? You know when you
Something's
start
decreasing.
Something's decreasing.
Yeah.
So then what you're thinking about, okay, why is that happening? Well, you're not getting that recycle, right? One bad cell out, one new cell in, that 1-to-1 ratio. You're starting to lose that. So the signal is not there, right? That's a regenerative medicine. So if you're not in that world and you want to still keep that performance, you're going to have to slow down and increase that rest time. You've got to get back to the 100%. So maybe it's not a 2-day race, maybe it's a 3-day, 4-day rest, but keep that same performance. You need to keep pushing yourself, break it down, and then have the ability to come back to normal and then go again. So you have to kind of like, it's almost like you're your own lab rat, right? You have to figure out, all right, I pushed myself 2 days ago, I'm gonna try it out, don't feel good, let's push it 3-4 days and go do the same type of workout. It goes, all right, I'm still there. And maybe if you give enough rest, you may even exceed that last exercise. Because, all right, now I'm getting better with bigger tissue. So you have to kind of experiment with that. So when you
Yeah.
break down tissue, it's all about the recovery component of it.
Yeah, that makes a lot of sense. Yeah, because I started CrossFit, and that's a pretty intense
Yeah.
workout. And there's a few guys in there my age that are going in there every day, and I noticed that I'm not as strong in the beginning of the week. And why is that? Well, I did CrossFit 2 days ago and didn't give myself enough time to recover. So I think the thought is that recovery, the longer the recovery, if you feel that your strength is losing or your body's breaking down, give yourself more time to recover between workouts.
Yeah, I think the big thing is that you want to ask yourself, what's my goal? My
Yeah.
goal is to like burn calories, or is it build muscle? You've got to first identify what you're trying to achieve.
Yeah.
If you're here to burn calories, well, you just have to do a longer duration. You don't have to have that one max rep. You don't have to do the extensive workout as far as like, pushing yourself into an anaerobic workout. You want to go more aerobic workout.
Right.
But if you're looking for performance, then you have to tailor to that workout. And so it all depends on what you're trying to achieve at the end.
Yeah, no, I get it. There's I guess two final things. One is the advent of AI. There's a lot of talk about AI, and I don't want to get too deep into AI, but there's just things are moving so quickly, and there's so much different data that's everywhere. What do you realistically? Do you see the idea of being able to end aging or being able to live to 120 or 130. Do you see that as being possible given the technology we're at now, all the breakthroughs in science? Do you see our generation, you're Gen X, right? Yeah, so me too. So do you see the Gen Xers being able to push that sort of top limit of the age even further than previous generations?
Absolutely. I
Okay.
think that AI is the best tool. I know people are scared of AI, but for us in our age group, we want it. Because now we're taking all this information that's out there and we're going to consolidate. We're going to gather it together. There's great research out in New Zealand, Australia. It's only like provided in a PubMD or some type of like citation that you're not going to see it. Well, believe it or not, AI can obtain that and pull it into your question. How can I live longer? I find more research? Just keep asking questions. Why is my telomeres shortening? How can I lengthen it? It can pull up. And then the neat thing about that is that now you're starting to understand this whole biology of our cells. Now you start asking advanced questions. What can I do? Learn about how to use AI in your form. Don't just take its form in a sense like, hey, whatever they give me, I'm going to take it. You can manipulate it. You can go ahead and twist the question around. When they give you an answer, repeat the question a different way. Let's see if it comes up the same answer. You want to make sure it concurs what they're saying back and forth. I love AI because when I have a patient that has AI, right, ChatGPT, and they say, hey, Chat told me my ankle is due to this. I said, great, let's talk about it. Now I inform him, yeah, they're right in some aspect of it, but they're also a little off with this, and I explain it to them. So I love when patients come in and talk to me about what they learned on the computer because it gives them more of a command. You want the patient to feel like they're in control. Nothing's worse than going to a doctor. The doctor says, don't worry about it, it's your need, take care. And then you're like, well, that was it? You want them to explain. Like I tell my patients the anatomy, the biomechanics. I go into everything so then they have a good understanding. So when we do therapy, aggressive or not aggressive, they understand why we're going that pathway. So AI helps you with that.
Yeah. I think one of the final questions I'm curious about is like, what's your personal sort of guiding principle around, healthy, long lifestyle, medicine? Is there a principle that you sort of adhere to in your own daily life?
I think there's one. So I'm a spiritual person, right? So
Yeah.
I have God. So God kind of leads me. I'm not supposed to sit here, believe it or not. I'm not supposed to be here talking. I've got my disabilities, whatever they call it, right? But
Yeah.
I'm not here to talk. But for some reason, it's just put upon me to do this, right? I don't know why. I just come across these athletes being in this kind of caliber of like sports world. I don't know how I got there. I just put my head down and I just do it. So, but then on top of that, on a secondary note, it's for selfish reason because I'm in that group where I want to live at 120, 150, right? I want to know about these things. And believe it or not, I have enough tools that I can kind of put things together. Goes, okay, let's see how this goes. Let's see if this is really proper in the sense that what these guys are saying, and I can test it real time with my patients. So it's like myself, patients, and we see it goes, it doesn't work. Let's go to the next theory out there. So it's for the two reasons right there.
Wow. So it's spiritual, mentally, and physically. It's all combined, right? And it's all symbiotic. And it seems as though what you're creating right now is really pushing sort of the edge of that and also allowing it for people who aren't necessarily professional athletes or billionaires that can fly to different countries and make sure that they have, the top rated stem cells, but it's actually accessible to anyone really that wants it.
Yeah, that's the most important thing.
Yeah.
It's the ability to have everybody enjoy this therapy.
Yeah.
That's why I'm excited about the next phase of this is a plant-based. Cost is going to be less than $100. The signaling is going to be the same potency as these stem cells. You're going to start seeing everybody. They're going to be upset with me once because it's out. They all know it happens. They just don't want to disclose it because hey, I can make more money with these controlled clinic injectables, cost of $7,000, and you get the same thing for less than $100 with a topical cream. And the neat thing about that, it's not just localized, it's systemic. So once you apply it on your skin, it goes to your body. Now you're talking about possibly the anti-aging where you can push that 125, 150-year-old person.
Wow.
Yeah, that's what I'm excited about
This
right
is
now.
Incredible. This is incredibly exciting.
Hey, man, thanks a lot,
You're
man.
right on the, you're right there at sort of the cutting edge of all of this.
Because, I think because of my mindset, I always feel like there's got to be a better way. 95% is going this way, 5% over here. That's me. I'm like thinking like, wait, it doesn't make sense. Why is everybody following this path? There's got to be an easier path. I'm like electricity, least resistance. I follow the easiest route. I go, this is easy. Let's go this route.
Yeah. Yeah, wow. So you see this as becoming eventually available to anyone who, can, have $100, potentially you can have a cream that could increase longevity, like assist with healing, and actually be able to do some of the things that right now only cutting edge stem cell therapy can be done on a topical cream.
Yeah.
Wow.
And at the comfort of your own home, you don't have to go to a clinic. You don't have to get that invasive needles and the risk factors of infection. So this is the best thing.
Wow.
You can go right in front of your computer, say what's going on, this thing, click, buy, deliver it, you got it.
Can someone buy it today?
So right now we're going through the process. It's
Yep.
going through what they call the FDA OTC route.
Right.
So we have to do some testing and make sure that's all cleared. And then once we get that cleared, it should be on the market before Christmas.
Regen. Wow. Dr. Tommy Rhee. You're something else.
Oh, man.
I'm serious.
Oh, man. Thanks, man.
Wow. This is going to be a real breakthrough. And I feel honored and privileged to have you come to the Alchemist Lounge today and just go through this with me.
Man, I'm excited to talk like this. It's awesome. Thanks, man. Made it easy.
Yeah, well, you have a lot to say, and you said a lot, and I'm still trying to digest it all. To think that just in this past, 5-10 years, suddenly we're at a point where that sort of healing's available, and there's a possibility that people from our generation could end up living, maybe 25% longer, and not just living, but living a lifestyle that's healthy, that you're actually physically capable and mentally capable and all of that. So that's a super, super exciting time to live. And so people like you are pushing boundaries around that and finding ways to be able to disseminate it to anybody and everybody. So I can't think of anything cooler than that, man. Thank you for coming in.
Hey, man. Thank you very much for...
That was awesome.
That was awesome. Great. Man, it was a great conversation.
Yeah, man.